Hi, good afternoon, everyone. On behalf of Central California Alliance for Health and the California Department of Public Health Immunization Division, we welcome you to our June 2021 immunization training. My name is Veronica Lozano. I'm Quality Improvement Program Analyst at Central California Alliance for Health. And today I will be starting off by giving a little update on the Alliance and our immunization efforts. Next slide, please. So the Alliance keeps track of two different measures in regards to immunizations. The first one is our childhood immunization status, which is Combo 10. This was a change that we did back in 2019, and it includes, for this series, it includes the rotavirus series, the influenza, and hepatitis A. Next slide. So our current rates for this measure is in Merced County. This is going back on a 12-month rolling period, and this is only for Alliance members in these counties. So in Merced County, if we look back to April 2020, we were at 18.38%. Versus April 2021, we're at 18.70%. We have a slight increase. Pretty much it's been flat throughout the last year. And same for our Santa Cruz, Monterey. We started off at 50.73 last year in April 2020, and we're currently at 50.81% for April 2021. And again, it's pretty much been flat. Considering everything that's happened in the last year, we haven't seen a huge drop, but as you can tell, we haven't seen an increase either. So next slide. The other measure that we track is our immunizations for adolescent, or our Combo 2. So this takes a look for our 13-year-olds and making sure that they are up to date with at least one meningococcal, 2 HPVs, and 1 Tdap. And so if you can go on to the next slide. Our current rates for this measure is for Merced. We are at 37.31% from April 2020, and currently, as of April 2021, we're at 35.90. So we did see a decrease in that measure in the last year. For Santa Cruz and Monterey County, we started off last year in April 2020 at 60.01%. And we're currently down to 55.02% in those two counties. So it's common, as everyone knows, due to the pandemic, we did see a lot of people not going to their well visits, and so that it does trickle down to our immunizations rates as well. The Alliance does continuously do promotion, whether it's mailers to our members, Facebook posts, and then also we do a lot of member outreach as well to encourage our members to, go back and get their immunizations on time and also stay to date with their well visits. As part of those efforts, we do have some Alliance Health and Wellness rewards. There are two that are for immunizations. Our first one is for infants, which is a birth to 0 to 2 years old. So if our members complete the childhood immunization series by their second birthday, they will be entered into a raffle for a $100 gift card from Target. Next slide. For our adolescents, if they complete the required immunizations by their 13th birthday, we do have a raffle for a $50 Target gift card. Next slide. And then on top of that, we also recently added this wellness reward last year, which is for our 0 to 15 months population. So every time they go into a well visit, that qualifies them for a raffle for a $25 gift card. And so these visits would be at the 2 to 5 days, the 1 month, 2 month, 4 month, 6 month, 12 month, and 15 months. And then we have one annual raffle that if they completed 6 or more of those well child visits, they can earn a gift card of $150. And so if they do all these, they are also eligible for the previous one for a $100 one as well. Next slide. And we did have a training. Some of you might have joined us back in March. We do have that recorded, and there is a link. We will share our slides later after the webinar today. So that's available if you ever want to go back and see that. This webinar is also being recorded, so that will also be available to you. And then we want to have you save the date. So our next training is scheduled to be Thursday, September 2nd from 12 p.m. to 1:30, again via WebEx. And so we will have our county updates from all 3 counties, Merced, Monterey, and Santa Cruz. And then also our focus will be the flu season. So, and we're going to be lucky to have Steve Van Tine come back and do that with us. Next slide. And now I would like to introduce Janet Chapman, and she will be giving us a update on CARE.
Great, thank you. Hi, good afternoon, everyone. Once again, my name is Jeanette Chapman. I'm a local CARE representative. I cover the Monterey County and area, and then my colleague Jared Timmons, he covers Santa Cruz County. I'll give you information about how to contact us towards the end of my presentation. So the topics I'm going to cover include some of the CARE2 software updates, past and upcoming, CARE2 data exchange, new provider enrollments, CARE-ME, just briefly touching on CARE-ME, and then I'll give you my contact information and a slide with additional resources. Next slide, please. So in order to meet the increased demand, CARE has made some enhancements and increased system capacity, and also has implemented a solution to increase the throughput of query messages. So you may have noticed that that performance has improved recently with those changes. We also have a new data repository based on the Snowflake platform that is available to local health departments. It includes at this time only COVID vaccination data, and it's at this time only available for immunization coordinators and EPI staff. So previous to the COVID vaccination effort that started in about December, we had an update to our reminder recall feature. So reports can now be customized to include either mailing addresses only, email addresses only, phone numbers only, or all 3. So for information about the reminder recall feature in CARE, please visit our website, careweb.org. We've updated our user guide, and there's also a tape training video. So as well as reminder recall updates, we had a software update back previously before the COVID pandemic effort. Release 2.7.2, that's the version that we are on right now. That update included minor changes, including adding the new COVID vaccines to CARE. For more information, a list of changes that were made, you can find the updated release notes by following the link on my screen, or you can actually view the release notes. When you've logged into CARE, you'll see the link on the home screen. Next slide, please. So upcoming software changes. We have slated the release 2.8 for the end of summer, early fall of 2021. This software update will include primarily data exchange fixes, but it'll also include the new iQuip module. So the CARE iQuip module will replace the COCASA extract that you may be using now to pull coverage rates reports using the CARE file. The iQuip module can be used to view clinics' pediatric and adolescent vaccination coverage rates, and it can help you target your outreach and increase vaccine uptake. And it may also be used as part of the VFC iQuip program visits. So in order for you to make the best use of the module, you'll want to be cleaning up your patient list before running the report so that you're viewing the data just for those patients that are still visiting your clinic or agency. The date of the release is still to be determined, but we are slating it for either the end of summer or early fall of this year. Next slide, please. We've also added the new meningococcal vaccine to CARE. So now if you are using CARE inventory, you'll be able to enter those lots for the men quadfi. Go ahead and continue, please. So I want to spend a little bit of time about how to add historical COVID shots into CARE 2. You may be seeing patients that have received COVID doses from either outside of California or outside of the United States. So most sites that are using on CARE Data Exchange have the ability to send historical doses as well as new shots from the EMR into CARE through Data Exchange. But if you either are using CARE and manually entering information, or you're not submitting historical doses into CARE and you have a regular user account, you can transcribe those historical doses by opening up the patient's record, click on History Recommend. It'll take you to the immunization record screen. And then you'll look for the Add Historical IMS button and click on that. And next slide, please, or next, click again. Okay, so once you click Add Historical IMS, the Add Historical IMS button, it'll take you to a screen where you can enter the information. So you'll scroll down to the part of the screen that says Enter Historical Immunizations. Look for COVID in the immunization column, and then in the field to the right in the dose column, go ahead and enter that date that is on the documentation that was brought in by the patient. And very importantly, make sure that you click Add Details. Don't click Save, click Add Details. Click again, please. So clicking Add Details allows you to choose the trade name. And if you are transcribing a shot that was given within the United States, you want to make sure that you're choosing the correct trade name. And if you have the lot number, you can also include that as well. If you don't see the trade name that your patient received for the shot you're transcribing, you can just leave it blank and click Save. It'll default to COVID NOS, in other words, COVID not otherwise specified. But at this time, it will show as an invalid dose in the patient's care record until we can get that fix made in our system. So just keep that in mind. If you see COVID NOS and it shows as an invalid dose and it was transcribed as a historical dose, it was probably because whoever transcribed it either didn't choose the trade name or the shot was given outside of the United States. Go ahead and forward. Click again. Thank you. And this is just giving you some additional instructions about what we just talked about. And just look for that change in our system. But for now, COVID shots transcribed as not otherwise specified will show as invalid in the patient's record. Click again. So for data exchange sites, this is very important. As part of the effort to improve capacity and performance, we are asking that data exchange sites change their data submission endpoint. So you'll need to make this change by August 31st, 2021. For additional information and instructions, go to our website, careweb.org/dx-submission-endpoint-change. If you need additional assistance, please contact the Care Data Exchange Specialists by email at caredataexchange@cdph.ca.gov. Please click again. So you may have noticed that our enrollment process has recently changed. So basically, if you are a provider that only wants to administer COVID shots and you need your IIS ID in order to start that process, we have some steps that you need to follow first. Before you enroll either for Care Data Exchange or for web access, please review the provider requirements for administering COVID vaccines before you begin any part of the enrollment process. Once you've done that, if you are enrolling only to submit COVID doses and you don't have an electronic health record system or you don't have an EHR that can interface with CARE through Care Data Exchange, you can enroll for CARE2 web access and choose the pandemic-only organization type. So this is a new organization type. You can only request read-only access for individual user accounts. But what you'll do is you're going to onboard your site to use MyTurn for submission of COVID doses to CARE2. And just keep in mind that if you input other doses other than COVID, you can still enroll for CARE web access and then submit those manually as well. So if you have an electronic health record system, please enroll through the CARE IZ portal for Care Data Exchange. And this would be for both your COVID doses and your non-COVID doses. Work with your electronic health record vendor to ensure successful submission of immunization data to CARE. And just a note, if you've already enrolled in CARE2, if you've already been submitting doses to CARE and you want to start giving COVID doses, you don't need to re-enroll in CARE to submit your COVID doses. Your CARE2 organization code is the same thing as your IIS ID. Click again, please. So user roles that require training. If you've signed up for web access, just remember if you're only submitting COVID doses, you're going to use MyTurn instead of manually entering those COVID doses into CARE. So you do not need a regular user or powered user access. Care Data Exchange users basically the same thing. You're submitting your doses electronically, so you don't need that regular user or power user access to manually enter shot records into CARE. Go ahead, next, click again, please. So if your site is submitting doses via Care2 Data Exchange, you can request a QA or read-only user role. No training is required for either of these user roles. Sites should only request the regular or power user roles if they are using manual entry to document non-COVID vaccine doses in CARE2. And if you need that user access, have your authorized site contact or clinic manager submit a CARE account update to request new user accounts. Click again, please. So just remember, CARE2 users regular users are required to complete a 2-hour Care2 training to receive their passwords. Power users should only be inventory managers. So Power User Access doesn't give you administrative abilities. It's just for those staff that will be managing inventory and care. Power users are required to complete both the regular and inventory trainings before they get their access. Click again, please. And then just keep in mind that we have a very, very large volume of requests for care trainings at this time. So if you're requesting regular or power user accounts, you may experience delays in obtaining your access just because our care trainings are filling up very fast. Please advance the slide. So the 2 user roles, as mentioned earlier, that don't require training are the QA user role. You can use that to look up patient records, print out patient records, and also run clinic reports as well, including the doses administered report, reminder recall reports, and you can also use the manage patient status feature as well. This user role allows you to monitor data exchange activity using the check status feature, which is very helpful to make sure that your site is successfully submitting your doses to the immunization registry. Read-only users can look up patient records and print out patient reports. Next slide, please. Medical exemptions. CareME is a secure website for physicians to issue and manage standardized medical exemptions for children in school or daycare. So it's a separate website. It's separate from Care2. Basically, it's a separate group, and it has its own help desk staff, etc. So providers that are seeking to manage standardized medical exemptions, they don't need a Care2 user account to do so. They don't need a user account to submit or view medical exemptions. So the CareME website is not only for providers, it's also for parents and schools and child care facilities to monitor and get updates for medical exemptions, and also to request the medical exemptions for their children. Next slide, please. So frequently asked questions, the link to the recorded provider webinar and other information can be found on the Shots for School website. To register to submit a medical exemption, you can do so by going to the website care.cdph.ca.gov/exemptions. And licensed providers can request assistance by sending an email to medicalexemptions@cdph.ca.gov. Next slide, please. So we've updated our COVID contact information. Here's the contact information for the provider call center and the public call center. Next slide, please. And then just for general resources, you can find information about enrollment, all of the useful links and information about COVID, administration of vaccines, and enrollment to administer vaccines on the easyiz.org website. For information about Care2, you can find our resources and links on careweb.org. To navigate through the website, hover over the blue bar up at the top. When you scroll over one of those subjects at the top, you'll get a drop down, then you can click on the subject you're interested in. If you are the site contact or a manager, you can request individual user accounts, update your site's contact information, transfer user accounts, inactivate users, add shot giver names to the care drop-down list, all by submitting an account update request. And to get to that website, click on the Manage Your Existing Care2 Organization Account link on our homepage. And next slide, please. So to contact the local care representative for your region, you can find a list of our contact information on careweb.org. The LCRs, they focus on different regions. So the best way to determine which LCR can help you with your care questions, it's best to look up their contact information on our website, click on that link, look for the name of your county, and then you'll find your region and your local care rep's contact information, and the list includes contact information for RIDE and SDIR as well. The Care Help Desk staff are responsible for resetting care passwords. So if you're having password issues, please contact them. If you're calling the phone tree, choose option number 6 to get a hold of the Care Help Desk staff, or you can send them an email to carehelpdesk@cdph.ca.gov. For data exchange questions, you can contact the data exchange specialists at caredataexchange@cdph.ca.gov. So that is basically the end of my presentation. Unfortunately, I don't have time for questions at this time, but if you would like to send your questions at the end of the presentation, I will respond to questions via email at a later time. So at this time, I'm going to hand controls or hand the presentation over to Justin to cover the RIDE updates. Thank you.
Hello, everyone. I'm Justin Labadie. I'm with the RIDE Immunization Registry Project, also known as Healthy Futures if you use the web interface. And this is basically just a status update to kind of give you an idea of what we've been working on and some of the progress that we've made. Obviously, we've all been consumed by what's been going on with COVID-19 for the past year plus. So there's been a lot of work going into that effort. So we'll go ahead and get started. Next slide, please. So just to give you a quick overview, the RIDE system was started in 1995, and we've been on the web since 2000, and we added HL7 data exchange in 2010. When you hear RIDE, think data exchange. When you hear Healthy Futures, think of the website that you log into to get to the immunization data. We serve 8 counties, and I believe Merced is on this webinar. So thank you for all of your support over the years. We really appreciate it. And at this point, we have a fairly robust user community, as well as over 1,500 sites throughout those 8 counties and about 2.5 million patients, which interestingly enough is more than the population. So we've had people come and go and people that cross county borders. So anyway, we've been, like I said, doing a lot of work as far as COVID-19. So we'll go ahead and see that on this next slide, if you would. So at this point, we kind of break this up into 2 parts. The early pandemic portion, and then what we're doing at the moment. So in 2020, there were a number of requests from CDPH and CDC to all of the immunization registries nationwide to start submitting information on COVID. At first, it was COVID testing, but now we've moved on to the vaccination piece. So there were 3 main places that information goes. There's CVRS, which is basically kind of, it's de-identified information that goes up to the CDC. Snowflake or IRIS, which is the state's data warehouse, and then MyCAVax, which is kind of a running total of the COVID-19 vaccinations that have been given. Um, over the course of 2020, we ended up having to respond to a number of emergent needs related to COVID response. Things like allowing providers to make vaccine requests and get those doses and the supplies shipped out and fulfilled so that they could start giving vaccination. We had a lot of, at the beginning of this, we had a lot of questions coming in from the public and healthcare providers. So we stood up a COVID intake and phone bank tracking system. Um, and basically a lot of this was tied into the registry data that we already had. Um, Before my turn came out in San Joaquin County, we had a project to determine who the high risk populations were so that we could get them vaccinated immediately. And that was called Vaccine Reach. That has been since retired and replaced with my turn, but it was a very valuable tool at the time. Again, we started with a product called Sign Up Genius to allow people to make appointments at their local at local sites giving vaccination. So that was another thing that, and of course, my turn has since replaced that, which is definitely good. We have a statewide system for that. Some of the challenges early on with the vaccines were understanding the schedules for the EUA, knowing exactly how the vaccines would be distributed. We had to make some changes in the system to handle those things. So definitely challenging times for everyone. Let's go ahead and go to the next slide, please. So part two. So this is going forward to this year. So as I mentioned, my turn came up early this year and has been the central point for a lot of providers to enter their vaccination data. So we've worked with the state and Accenture and other parties to make sure that that information is flowing properly to all of the registries, including RIDE. And you'll see that as you use the system, you'll see that data is flowing in on basically it's almost a real-time basis. So the shot is given, and within I believe there's a 4-hour hold on the data, but once it's released, it will come into the system. Numerous modifications and requests have come out of the state and federal levels to give them data that they can use to to better target their efforts. So we've been working on a lot of those items. Um, we worked with Kaiser to get some additional detail in their data exchange messages so that we can tell exactly which site the vaccine was given at, and that will has contributed to improving the amount of detail we can show for each county. Um, our team's also been working with within public health and the different counties within the region to identify and contact those high risk populations so we can get them vaccinated as quickly as possible. And then, of course, we've had some changes, and we'll probably see more changes to the vaccine schedules. So those have, those potentially will start changing if there are boosters, and there are some open questions right now as far as some of those schedules. So um, we've been busy as on this side as I'm sure you all have been. Um, let's go ahead and go to the next slide, please. So we have uh, we have some things that are on the radar on the roadmap right now. We're looking at some enhancements in the system for data quality. We want, our goal is always to have accurate data and have the details that we need to be able to ensure that we're giving the patients the best care possible. So as part of that, we're going to be enhancing some of the quality assurance tools in the system so that our help desk staff as well as county staff and provider staff can collaborate on helping to improve the quality of that data. We'll also be looking at making some enhancements to provider onboarding. One of the things that COVID taught us is that we really need to have a streamlined way to get people, to get vendors, or to get users and providers onboarded and up and running with the system quickly without overwhelming our help desk. So there are some projects related to that in the works right now that will make everyone's life hopefully a little bit easier. We're also looking at some security enhancements. If you've been watching the news at all, you've seen organization after organization have security breaches and issues related to that. So we want to make sure that doesn't happen to us. And as part of that, we've got some enhancements on the way that will improve that security posture. And then finally, data exchange between the registries in California. So this was a project that we were working on prior to COVID. And when COVID hit, it obviously the COVID response piece took priority, but this is still very important. So we will continue to work on this and come up with an easy way for that data to be accessible if it's needed outside of the 8 counties that RIDE currently serves. And of course, we have to balance things like the quality of the data. We want to make sure that when we pull a record in, we're confident that that is in fact the accurate information that we want to pull in. So we'll put some safeguards in for that as well. So that project continues, and hopefully we'll have as COVID potentially winds down throughout the balance of the year, we'll start having some resources available to kind of re-energize that effort. And let's go ahead and go to the next slide, please. So this is my ending slide, but basically I did want to let you know that we all on the RIDE team really appreciate the support of our users and providers and our vendors who make all this happen and work with us to get the data to us. And our help desk is standing by if there are any questions or things that you need, training needs, really anything related to registry. We invite you to contact us. You can contact us at the support at myhealthyfutures.org email, or by phone at the 209-468-2292 number, and we'll be happy to help you. So once again, thank you. And thank you for all your efforts during the past year plus during COVID, and we look forward to continuing. So with that, I'll turn it over to Steve.
Good afternoon, everybody. Can you hear me okay? Just give me a thumbs up from the panelists so that I know that my volume is okay. Thank you, Cecilia, for the thumbs up. I appreciate that. Next slide, please. Today we're going to talk a little bit about the changes to the California's medical exemptions law. I'm sure that you've heard about that, and Jeanette mentioned these previously in part of her presentation. We're going to work in a little back-to-school immunizations. I get a lot of questions about with the pandemic, have there been changes in school laws? And the short answer is no. We'll talk a little bit about that in just a few minutes. And then we're going to talk a lot about addressing vaccine hesitancy. With the pandemic going on, there's been raised concerns about the efficacy and the safety of the vaccine. Is it safe to take it with existing immunizations? And I'm sure there's a lot of you out there in those clinics and at the local health department level that have had a lot of questions about this. So we're going to give you some information about how to deal with these situations. Next slide, please. And for those of you that have listened to my presentations before in the past, my disclosure statement has not changed any. I don't get any kickback from the pharmaceutical industry. Everything that I talk about has been vetted and or comes from the CDC, Department of Health and Human Services, et cetera, et cetera, et cetera. Next slide, please. Next slide, please. So back in January 1st of this year, not like we didn't have enough going on with the pandemic, there was an all-new medical exemptions must be issued through the CARE-ME website. And for those of you that work with medical exemptions on the clinic side, you know what a challenge it's been working with the providers and the parents, and so this has to do with school issues. So just quick notes here, the existing medical exemptions issued before 2021 are valid for continuing and transfer students until the earliest of the following dates. First of all, when the child enrolls in the next grade span, so every time there's a jump in the grade spans, TK through 6th grade or 7th to 12th grade. The expiration date that was specified in the temporary medical exemption, once that date has come to pass, then they need to reapply. There may be a revocation of the exemption because the issuing physician has been subject to disciplinary action from the physician's licensing entity, which here in California is the California Medical Board. So, and they are not filed on the CARE-ME website. Next slide, please. The California Department of Public Health will start reviewing exemptions in the CARE medical exemption website when a child care facility or school sites report immunization rates that are less than 95%. So if you have schools in your areas within your county, you can check with the County Board of Office of Education and your local health department. They should be able to give you the immunization rates for your county. Or if there is a school or school district that does not report immunization rates, something to think about. Physicians who submit 5 or more medical exemptions in a calendar year. There are some places here in California, down in Southern California particularly, where there are some physicians that issue a lot of medical exemptions. That's a red flag for the system. Review is deemed necessary to protect public health. One thing that has become apparent, and we'll talk about this as we get into vaccine hesitancy in just a few minutes, with the pandemic, we're really concerned about vaccine preventable diseases going up on the rise. So we want to stop that. And one of the ways that we can do that, obviously, is to make sure that our school-age children, especially in the primary series of 2, 4, 6, 12, 15 months and prior to kindergarten entry and 7th grade entry, that they are vaccinated and up to date on all their vaccines. We don't want these kids getting sick, especially if there's a vaccine out there to prevent it. The system also prevents physicians from submitting new medical exemptions if they are on probation. So if they have a mark against them and they're on probation, there's a probationary status listed against their license, they will not be able to mention or to issue medical exemptions. Next slide. Medical exemptions should be consistent with the relevant standard of care, so best practice and standard of care, and or meets the applicable criteria from the Centers for Disease Control. Back one, please. Thank you. From the Advisory Committee on Immunization Practices, ACIP, which when we're talking about the immunization schedule, of course, we always follow the ACIP schedule, and the recommendations made from the American Academy of Pediatrics and, of course, the California Academy of Pediatrics. Next slide. If you have questions about medical exemptions, you can always go to the website that's listed here, medical exemptions at cdph.ca.gov. If you have IT issues with the CARE ME, you can go to the medical exemptions website, or you can call at 844-699-4225. You can always go to Shots for School, and Jeanette's slide in her presentation, of course, had that information. So this information will be made available through the presentation. It is being recorded, so if you missed something on here or not able to write this down quick enough, we'll make sure that the Community Health Alliance has this information available, as well as your local health departments. Next slide, please. So, falling immunization rates during the pandemic. Next slide. This came out in an morbidity and mortality weekly report from the Centers for Disease Control during the pandemic. And there's an unnerving trend, very concerning trend, that fewer childhood vaccines have been given and were given during the COVID-19 pandemic. And of course, a lot of this is hesitancy on the part of the parents. They're not sure about going into the provider's offices to get the vaccines, whether or not they still need the vaccines, whether they need the vaccines for school. So it was very alarming to a lot of us that have been in the vaccine business for quite a number of years. Next slide, please. One of the things that we did was we went into the California Immunization Registry and analyzed data, comparing it from April of 2019 to April of 2020. As you can see down there in the lower right-hand corner of this graphic, there was a 48% drop in vaccination rates in 0 to 18 years of age when we're looking at kids in 2019 as compared to kids in 2020. If you look at 2019 data, there was over 849,000 doses of vaccines that were administered, comparing that into April of 2020, where there was only 442,000 doses. Alarming that there was such a decrease in the vaccination rate. Next slide, please. So here's some information just to give you a graphic comparing 2019 to 2020. 2019 is the gray background that looks like a mountain range. 2020, which of course is kind of all over the map. You see that dip where we highlighted April of 2019 and 2020. We also were able to get some updated information for 2021 and notice that as things are starting to return to post-pandemic and people are starting to get vaccinated with the COVID vaccine, that immunization rates are starting to come back up. This shows MMR that was being administered in our kindergarten entry kids. Notice that there's a decrease rate of about 19% in 2020 versus 2019. Next slide, please. For Tdap doses for our adolescents, 11 to 13 years of age, this again comes from the California Immunization Registry. You notice in April, again, what the average is, and then you see in the dotted line there for 2020 that there was a dip. There was a 21% decrease in the number of vaccine doses given for Tdap in 2020 versus 2019. Very, very concerning, especially when you consider that pertussis goes away and tetanus does not go away. So we need to get out there and make a concerted effort. However, if you do look at the blue line there for 2021, it looks like vaccination rates for Tdap are starting to come back around, which we're really, really happy to see that. And that's because of all of your efforts out there promoting regular childhood immunizations and for back to school. Next slide, please. So during the pandemic, and I still think that this is going on to a certain degree, the American Academy of Pediatrics voiced their concern that exists in the delays in the vaccination. And they're concerned, of course, about secondary outbreaks with vaccine preventable illnesses, which we already mentioned. The CDC made a statement about with stay-at-home and shelter-in-place orders, limiting movement outside the home, caused a great decline in pediatric visits, especially well-child visits, and fewer vaccine doses being administered. And this leaves kids at risk for vaccine preventable diseases, including measles and whooping cough. And for those of you that have been following what's been going on around the world, it wasn't that long ago, 2018, 2019, that we had measles outbreaks here in California and throughout the world. So if you need more information on that, please shoot me an email. I'll give you that information when we get done. We can, I can send you some links so you can follow the measles outbreaks and what happened with whooping cough. CDC's public sector vaccine ordering data showed a 14% drop in 2020 compared to 2019. That means that of all the doses that were ordered in 2019 versus 2020, 2021, that there was a drop in the order because the demand wasn't as high. Parents were reluctant and reticent to bring their kids in for well-child checks. So very, very concerning trend that was going on during the pandemic. Next slide. Just going to touch briefly about some disparities in vaccination rates and talk a little bit about our most vulnerable populations. Next slide. African Americans and Latinx and other communities of color often face discrimination when they seek care, which is something that we all need to address. Medical violence and institutionalized racism has swayed many not to trust science, the healthcare system, and government. And if you think about that statement, you know, bringing our patients of color and our communities of color in for routine vaccinations, regardless of age, is very, very concerning because we need to make sure that we instill that sense of trust in the medical community so that they'll come in and not only get the regular vaccines, but also get their COVID vaccines. Something, if you've been following the news, is a challenge for those of us that work in public health. And that leads us into our next bullet there where it says public health community faces many challenges, including distrust from communities of color and relies on trustworthy community members to relay important messages. So we'll talk a little bit about that as we address vaccine hesitancy. Next, please. This is just a quick shot of immunization rates by 2 years of age by ethnicity. And you can see that this is data from 2011, 2012. So I realize the data is a little bit older than what we'd like, but this is a trend that continues that we see today. So if you look, the white community versus Latino community versus African American community in the blue, and the Native American community, which is in the pink color there, really, really concerning data there. So we need to do something to get past the disparities in healthcare and address some of those issues. Why are there issues with folks coming in for healthcare? Next slide, please. For our older population, disparities in healthcare not only affect kids and our adolescents, but it also affects our adult population. If you take a look at this slide here, just quickly, you notice that our African American community are less likely to get a flu shot than our white or our Latino communities. And those immunization rates, 40% is not good. We're shooting for 75 to 80% in our adult population and our 65 adult population. Next. Chronic conditions. These include asthma, diabetes, heart disease, and obesity. And if you look at some of those bar graphs there, the Asian, African American communities, Asian is a light blue color, African American community is in the darker blue color there, and the Latino population, these are heart disease percentage rates by ethnicity. So things that we really need to look out for. Next slide, please. Older adults that are at risk with chronic conditions, our older adult population, they are more susceptible. If you looked at that or paid attention to the previous slide and noticed the prevalence in some of the other population groups based on the disease, the chronic conditions, that makes them more at risk for preventable diseases and complications if they defer the vaccine. So one of the things that we want to do, of course, is recommend influenza, pneumococcal, hepatitis B, Tdap. We want to protect our older adult population from pertussis so they don't spread it to the younger little kids that haven't had a chance to be vaccinated. If you think about some of our communities, it's the grandparents that help take care of the kids. So if they're not vaccinated, the chance that they might be carrying the disease to the kids is greatly increased. And of course, herpetic zoster disease, so shingles, we want to make sure that we protect that population. Next slide, please. Our homeless population, for those of you that were around for the hepatitis outbreaks a couple of years ago, our homeless population that are experiencing drug abuse are at greater risk for hepatitis A, so we want to make sure that they get vaccinated for hepatitis A. Next slide, please. Our prenatal immunizations are really, really important. This is something that we've addressed in numerous presentations before in the past, and of course, we'll address again when we talk about influenza in September. Next slide, please. One thing we want to make sure of course, and this just gives you some idea of the percentage of individuals, maternal mom, pregnant moms that either get Tdap or don't get Tdap. Notice that if they have private insurance, they're almost twice as likely to receive Tdap as if they are a Medi-Cal recipient. And if you look in the Hispanic, the Latinx, and the African American population, they are less likely to be vaccinated with Tdap, which is something that's really, really concerning. And for those of you that recall, the latest recommendations for Tdap are that they get a Tdap in the third trimester with each pregnancy, not just once in a while, but with each pregnancy. So that's something that we need to address. For latest recommendations, of course, you can go to the CDC's website, and I provided the link down there, and we'll make these slides available to you. I know there's a lot of information we're trying to cover in the next half hour. Next slide, please. Flu immunization rates kind of reflect what we see in the Tdap rates. Next slide, please. Low rates of flu vaccination during pregnancy. These are just some select counties. For those of you that are, let's see, we've got Monterey in there. They didn't do too bad. They're a little bit over 70%. Let's see, I tried to get some Central Valley community or counties in there, Fresno counties in there. They are just a little bit above the 50 percentile mark. So we can get this, this data comes from MIHA. We can get this for your particular county if you want. So please contact either CCAH or you can contact us at the California Department of Public Health when we can find out what's specific for your county. Next slide, please. Immunizations are essential regardless of age. National and state health experts agree that immunizations are still essential, especially now during the pandemic. For those of you on the provider side, I admire you that when they come in, especially at the beginning of the pandemic, and they present with upper respiratory symptoms, differentiating between COVID and pertussis, influenza, RSV, and all the other numerous upper respiratory diseases that are out there must have been a considerable challenge at first. So I applaud all of your efforts, especially during the pandemic. Healthcare providers are encouraged to bring patients in of all ages to catch up or stay current on immunizations, and that includes kids that are of school age, and we'll talk about that in just a second. Next slide, please. Oh, here we go. Back to school immunizations. I had a phone call just earlier this morning from a concerned parent in one of the local Bay Area counties wanting to know if the school laws had changed. Surely the school laws had changed. I'm sure the school laws had changed. These are their words, not mine, because of the pandemic, that we were doing away with all immunizations. I'm not quite sure where this individual got the information, but immunizations, goal requirements for school age and child care entry did not change during the pandemic and are still in effect for the 2020-2021 school year. So immunizations are required for childcare and pre-K, kindergarten, and 7th grade. For that information, you can always go to the Shots for School website, which is shotsforschool.org. Made the link Stephen proof so that even I can find it when we go in, and all you have to do is type it into your search engine, and it'll pop right up and take you to that. Next slide, please. Let's talk a little bit about vaccine hesitancy. Next slide. What's important for parents to know about vaccines? These are some of the things when we're deciding what it is that we want to talk about when we're talking about vaccines, regardless of the kind of vaccines, whether it's for our infants, so our 2, 4, 6, 12, 15 months, our kindergarten entry at 4 to 6 years of age, and our adolescents that are going into 7th grade, but also our adult population. Because for those of you that are out there, I'm sure that most of us don't stop to think about, but we are considered part of the adult population, and we want to make sure that we get the vaccines that we need also. So what's important for our parents, not only our parents, us as patients, what do we need to know about the vaccine? So we need to do a little bit of homework before our patients and our parents come into our practices. There are research-based resources that are available for healthcare professionals, and we'll talk about some of those in just a minute. Make sure that when we're talking with our parents, if they want to get more information, that we refer them to reliable and definitive scientific resources that are available online. I don't know anybody out there that probably hasn't used Google once or twice, but if they're going to go into Google, we want to make sure that they skip the first several because they are generally advertisements. It says ad at the beginning of the link. So we want to try and steer our parents away from those and steer them to reputable scientific information like the California Department of Public Health, the CDC, the Advisory Committee on Immunization Practices, ACIP, NFID, and I'll give you some more resources in just a minute. Keep the conversation going with CDC. The CDC has wonderful resources. Matter of fact, the next part of this presentation is adapted from information that's available on the CDC's website about addressing vaccine hesitancy in parents and adults that are reluctant to get vaccines. Next slide, please. CDC research shows that parents and patients don't really know much about vaccine preventable diseases. If you think about it, for those of us that have been in the vaccine business and been in public health for a while, if you go back 1 or 2 generations, that, some of these diseases were still out there. So when our parents heard about them, oh, did you hear about little Johnny next door or Jane next door? She came down with the chicken pox. And, it may have been before the chickenpox vaccine was available. Or how about those of us that still remember the neighborhood chickenpox party? The kid across the street had a bad case of chickenpox, so they brought all the kids together and exposed that individual to chickenpox. And if they didn't pick up the disease there, where did they get it? They got it at school, which is why it's so important that we emphasize the importance of getting school immunizations with our parents. We want our patients and our parents to hear consistent information from sources that they consider credible. There is a lot of misinformation, a lot of myths out there. I'm not sure where it comes from initially, but we want to make sure that we are referring them to reputable sources of information. And we also need to be prepared with reviewing some of that information ourselves. The internet is, recent studies have shown that the internet is a frequent source of vaccine information. And if you think about it, even when I do research to prepare for presentations, of course, I go to CDC's website and ACIP, but I also may want to, I heard a rumor that not too long ago that COVID vaccine was like MMR and it caused autism, and nothing could be further from the truth. And there's a lot of studies going on about some of the comorbidities and some of the possible side effects for the COVID vaccine and some of the other vaccines that are out there. So we need to make sure that we have reliable information. Next slide. So what do we do? How do we instill vaccine confidence in this day and age with so much information that is so readily available at our fingertips? Next slide. Vaccine confidence. We need, first of all, we need to define this for ourselves as healthcare workers. This is the trust that patients, parents, and providers and their staff have in the recommended vaccines. I know that there has been a lot of information, especially about the COVID vaccines, since they became available back in December of last year. Every time you Google some information or you look at a website or you're watching the news, there's something about they had some kind of comorbidity going on, some kind of side effect that they assumed was from the vaccine. So we need to make sure if a vaccine is recommended that we understand as much as we can about that vaccine. The trust that the parents have in the providers. The providers are the #1 source to go to for information about vaccines because you are the subject matter expert. Our parents trust us to come to us to ask questions about that. And there's really wonderful information for an algorithm that is in one of the other presentations that we've given that talks about how parents come in and they come to us as providers and healthcare professionals to get that information. We need to be familiar with the processes and the policies that lead to vaccine development, licensure, manufacturing, and the current recommendations for its use. And nothing has made this more relevant than the astonishing speed with which the COVID vaccines became available, the research that was done, a lot of the studies that were done concurrently. And of course, we've talked about that in one of our previous presentations. Next slide, please. So vaccinate with confidence. This is the national strategy. This came from the CDC, and I put the link down there at the bottom for you. First of all, that we need to build trust. Second of all, we need to empower our healthcare personnel. And then lastly, we need to engage communities and other individuals that are communities or local communities, whether they're communities of color, religion, that they turn to for information. We'll get into this a little bit more detail here in the next few slides. Next slide, please. So strategy #1 is to build trust. We need to share clear, complete, and accurate information and messages about the COVID-19 vaccines, but this also applies to all vaccines, not just COVID-19 vaccines. Take visible actions to build trust in the vaccine, the vaccinator, that's those of us that give the shots, and the system in coordination with federal, state, and local agencies and partners. So the clinics or the private providers' offices working with the local health departments, who in turn work with the California Department of Public Health and the Centers for Disease Control and Prevention and the Advisory Committee for Immunization Practices. Next slide, please. Continuing on the building trust, we need to communicate transparently. We have nothing to hide. We have the information. We're the subject matter experts. Remember, our parents and our patients turn to us first. They come to us and say, gee, doc, I've heard about this vaccine causing blah, 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 and we need to be prepared to address those concerns with our patients. But we also need to be somewhat familiar with how the vaccines are authorized, the recommendations, monitoring for safety, the distribution and allocation, which is something that happens more on the local health department side, but as we bring on more partners for the distribution and administration of the COVID vaccine, we need more information about and become familiar with the information about the processes that occur, including data handling. One of the things that Jeanette had talked about in her presentation was adding historical doses. Somebody got one of their vaccines at a local pharmacy, and then they come to your practice to finish up their vaccines. Regardless of the kind of vaccines that they are, we need to make sure that the data gets entered into the immunization registry or into your own electronic health records. Provide regular updates on the benefits, safety, side effects, and effectiveness. Clearly communicate what is not known. If you're not sure about, say, a particular side effect or something that the patient has heard, and they're addressing those concerns with us, be upfront with them. Say, gee, you know, I had not heard that yet, but let me check into it for you and I'll get back to you. Proactively address and mitigate the spread and harm of misinformation. This is probably one of the biggest things that I do in my job when I'm not doing presentations, is dispelling myth and or referring individuals, whether they're our local patients or their parents, but also some of the providers and their staff when they have heard something. Most of the questions that I answered last week came from back office staff for something that they had heard or read on the internet, and it was conflicting information about some of the vaccines that were available. Next slide, please. I like to use the truth sandwich to address vaccine myths. I love this analogy, and it's something that I think about anytime when I'm talking to somebody or responding to emails. But you always start with the truth. You know, somebody heard something, and you say, well, what is actually going on is, and then explain it. Indicate the misconception. So you're going to talk about, well, we heard that it was like the example that I used earlier that COVID vaccine might cause autism. There is no scientific evidence to prove that at this point. There's a lot of ongoing studies. So until that information becomes available, then it's, you know, it's something that, yes, it's okay to be concerned about that, but we're waiting to get more information on that. So we need to be upfront with our patients, but address what we do know, not what we don't know. And always return to the truth. Always repeat the truth more than the misinformation that they have heard. Next slide, please. So we're going to use COVID vaccine because it's something that, of course, is on everybody's mind. And I know a lot of you that have logged in today had some questions about that from some of the pre-questions that we got. So you want to start with the truth. COVID vaccination is the best way to build protection against the disease. Yes, there's been a lot of misinformation out there that it is safer to catch natural disease. And for those of us that are in the vaccine business know that it's safer for our patients to receive the vaccine and to build immunity that way. Sandwich the myth. Some people mistakenly think that getting the disease is a better way to build immunity. We just addressed that. And end with the truth. And I like the way that the CDC phrased that. However, the risk of severe illness and death from COVID-19 far outweighs any benefits from natural immunity. COVID-19 vaccination will help protect you by creating an antibody response without the risk of severe illness. How many of us out there have had a friend or relative that have contracted COVID and have unfortunately passed away from that? Would they still be with us if they had received the vaccine? Hard to tell on that one, but we can only move forward. Next slide, please. Empower healthcare personnel. This is something that is near and dear to my heart. I spent some time, several years, almost 11 years as a matter of fact, as a senior field representative with the Vaccines for Children's program. And nothing was more concerning to me than to be in a provider's office waiting to speak with the provider or the back office staff and overhear somebody in the back office say something to the effect, oh, I never get the flu vaccine because it always causes the flu. And, you know, if we go back to our truth sandwich, this is where our work is cut out for us because we really need to do some work there. But how do we empower healthcare personnel? We need to promote confidence among healthcare personnel in their decision to get vaccinated and to recommend vaccination to their patients. And that example that I just gave you is a perfect example of why we need to work with our healthcare personnel in the back office. Make sure that everybody's on the same page in the practices or the clinics that we work in. Make sure that healthcare systems and medical practices are equipped to create a culture that builds confidence. So again, this goes back to training. We want to make sure that all of our staff understands why it is what we do. And that starts with the provider and any ancillary provider staff like physicians assistants or nurse practitioners. Make sure that everybody's on the same page and you're all promoting the vaccinations in your practice. Then we want to strengthen the capacity of healthcare professionals to have empathetic vaccine conversations. Now, You know, it really depends on the individual practice, but we all need to bend an ear and to listen to what the concerns are from our parents and our patients when they come in, regardless of the kind of vaccine that they're getting. We want to be able to address any myths and any common questions that they have. So we may have to have the provider come back in the office and say, I understand that you had some questions about the vaccine that you or your child are getting today. What can I do for you? Provide tailored vaccine information to the patients. That's why we have vaccine information statements. There may be some concerns that aren't addressed in the vaccine information statement, and we need to be prepared to address those concerns. And this one I really like is using motivational interviewing techniques when needed. We want to prompt our patients to talk with us as the healthcare providers about what's going on. It is something that I've always found kind of unique, having come from a local public health at a county level and worked in private practice myself, where somebody will come in and they will say, you know, being a nurse and working in the back office, they will share things with me that they're almost afraid to talk to the doctor about. And of course, you know, we always relay that information to the healthcare provider and let them know what our patients are talking about and what some of the concerns are. But as a provider, we also need to be able to prompt that information from our patients, help them not be afraid to talk with us about what's going on, whether it's a concern about a vaccine, a particular vaccine, or some questions about how the vaccine was produced. Next slide, please. A little bit more about empowering our healthcare personnel. You want to make sure we support for vaccination in the practice. When the vaccines become available, whether it's annual flu vaccine or COVID vaccine or whatever, we need to make sure that we vaccinate our staff and that they understand why that we do it. They're not only protecting themselves, but they're also protecting your patients. Patients and parents can feel more confident about vaccinating when everyone in the practice shares the same message. This is something that we just talked about in the previous slide. This includes everybody in the practice, from front desk staff to the exam room to checkout. Everyone plays an important role in supporting vaccination. And we need, as a practice, not as individuals, but as a practice, it's a team effort to adopt these best practices and ensure that you never miss an opportunity to vaccinate our patients. Next slide, please. This is a little bit of more information, gives into a little bit more depth, and as we're a little bit pinched for time, I encourage you, when you review the presentation at a later time, to review some of these. I do want to point out, though, these are some of the best practices. These come right from the CDC's website. Number one thing is make sure that the patients and the parents are aware of your immunization policy. And you also want to make sure, excuse me, that vaccine resources are easy to find in your practice. This includes vaccine information statement. For the rest of those, you can read those when you go through the presentation again on your own time. Next slide, please. We want to engage communities and individuals. One of the things I've been following on Instagram is a faith-based organization links for our communities of color and promoting the COVID vaccine, but they're also promoting routine vaccination. So California, Immunization Action Coalition, the National Foundation for Infectious Diseases, NFID, has wonderful information about how to incorporate and use other community groups like faith-based organizations to help get everybody vaccinated and understand the importance of vaccination. We also want to utilize the resources that we have available at our local health departments. All local health departments in the state of California have an immunization coordinator. Some of them are fortunate enough to have larger immunization staff, and they can certainly help you as a private provider or a federally qualified health center to make sure that you have resources available for immunizations. Join local immunization coalitions. These are something that are really, really important. I know that there's one in the Central Valley. There is one that's sourced out of Monterey County, the Monterey County Immunization Coalition. So work with these folks. And also third-party payer groups like our host today, the Community Health Alliance. They have resources that are available, and if they don't, they can help connect us with groups that can provide more information to our practices and to our patients. Next slide, please. Engage communities in sustainable and equitable and inclusive way. Everybody deserves to get vaccinated. That's why there are so many programs out there to vaccinate everybody, regardless of ethnicity, color concerns, ability to pay. Everybody should be able to come in and get vaccinations. So we want to make sure that all of our patients are aware of these resources. And we need to make sure, excuse me, it's like with the Vaccines for Children's program, VFC, that they have postings out in the waiting area that Vaccines for Children's vaccines are available. Excuse me 1 second while I get a sip of water. There, hope you can better understand me. Make sure that you use two-way communication to listen, build trust, and increase collaboration with community-based organizations, of course, but local coalitions and some of our patients. Who knows? You may be able to instill in one of your patients the desire to found their own immunization coalition for your local community. Next slide. Some quick key messages to promote vaccinations, and then we're going to wind things up. Next slide. Just remember that Medi-Cal covers all routine adult immunizations, such as flu, at your doctor's office, a prenatal care center, local pharmacies. Pregnant women should be able to get immunized for free at the same pharmacy where they pick up their prescription for prenatal vitamins. Next slide. One thing that we really need to get the message out there, because I still hear from some provider offices, it's safe to go to your doctor's offices. A lot of doctor's offices are following CDC and California Department of Public Health guidelines to take additional steps to make their visits safe. They require their staff and their patients who are greater than 2 years of age to wear a mask while in the practice. Spacing out well visits and sick visits. So you do your well visits in the morning and your sick visits in the afternoon, or maybe you're alternating days. And of course, basic precautions where you're disinfecting the rooms between appointments. Some practices are even offering drive-up or curbside shot appointments. I know in the East Bay, there's a private provider that has parking places set aside so you can drive up and get your vaccine. So something to think about. Next slide, please. Key messages for our parents, especially those, of pediatric patients. As California reopens, more families bring their children back in for shots, especially if they're needed for daycare or school. Again, I cannot stress enough that school law and daycare immunization requirements did not change during the pandemic. So call ahead. Make sure that your provider has an appointment available for you, because as everybody's coming back and schools are starting to reopen, daycares are starting to reopen, you might be squeezed for an appointment. So give them a call. Let them know that you have appointments that are available. This is a quote from a parent. I like this. I would not wait to immunize my baby. Getting your baby caught up on immunizations is something that is easy and you can do to help protect him or her from diseases that could cause harm during and after the pandemic. Think about pertussis, influenza. There are things that are out there. Make sure that you check your baby's milestones, and staying up to date on immunizations are an important part of your child's health, even during the pandemic. Next slide, please. Some key messages for our adult population. It's time for a checkup. When was the last time you were in to see your doctor, other than maybe to get a refill on your medication? If you have asthma or diabetes, you're clinically obese, you have some kind of chronic heart disease, whatever, you need to get in to follow up with your provider. Find out if you're due for some vaccines, some routine vaccinations. You can get that information from the Advisory Committee on Immunization Practices, ACIP. There is a schedule for adults. And there is one that I really think is cool for our adult population. Unfortunately, we don't have time to go into that, but you can go to the ACIP's website and pull that up and take a peek at it. Staying up to date with vaccines is still possible, even if you lost your health insurance. because there's a program here in California called the Vaccines for Adults, and you can go to easyIZ.org and check for provider locations that offer adult vaccinations, mainly at federally qualified health centers. Next slide, please. We're kind of at the end of flu season and getting ready to jump into another flu season, so let's go ahead and skip this one and we'll go to the next slide. Some key messages for pregnant women. You can see here, if your doctor doesn't stock flu vaccine, doesn't mean that it's not important. Your baby's health is important, so make sure that you get your flu vaccine. Flu is very dangerous for pregnant women. We want to make sure that you get a dose of flu vaccine with every year. Millions of pregnant women have safely received flu shots. That is a question that I get on a regular basis. Next slide. Some resources that are available to you, and again, this slide presentation will be available so that you can look up this information. To address concerns about vaccines, the vaccine safety, are vaccines safe? Dosing safety, we get a lot of questions still in this day and age. You know, I took my granddaughter in for her first set of vaccines, and I believe she got 6 shots. Doing what I do, I know that it's safe for the baby to get 6 shots, but there's a lot of parents out there that are concerned. I had a call just last week. There was a parent that wanted to know if they could space out the vaccine so they were only getting 1 shot a week, which is something that ACIP, nor the California Department of Public Health, nor your local health jurisdiction at the county level recommend. You should get your vaccines following the ACIP schedule. Vaccine safety, immune system, and health. What's in vaccine ingredients? I'll give you some more resources here in just a minute. By the way, when you pull these up, you should be able to just click on those links. Those are all active links. Next slide. The California Department of Public Health has some special activities going on. We track immunization information, as we showed you earlier, through CARE2. We send out communications to medical providers and other stakeholders for VFC providers, and some of you out there in the audience are VFC providers, so you're aware of this information. There is a call to action here from the American Academy of Pediatrics with their California group regarding the gaps in immunizations. Sharing the CDC's pandemic immunization guidance. Yes, it's okay to get vaccinated during the pandemic. Sharing best practices, interviews, we talked about that a little bit earlier. California Department of Public Health has the Don't Wait, Vaccinate campaign, which is going on, which gives you all kinds of information at the provider level that you can do. And keep in mind, for those of you that use the CARE2, the California Immunization Registry, that there is a reminder recall feature so they can help you determine which of your patients need to be called in for which vaccine. Next slide, please. Other resources, I'm going to go through these kind of quick. We got one more slide after this one, so we're going to wrap up right on time. From the CDC, of course, immunization and influenza resources, the Childhood Vaccination Toolkit, wonderful resource. I wholeheartedly recommend it, that you open that link and take a look. The vaccine catch-up schedule, in case you are behind and you know some of your patients are behind, which vaccines they need and when to get them and how to get them caught up. There is a page for families on it from the CDC. From the California Department of Public Health, of course, we already mentioned Don't Wait, Vaccinate Toolkit. Immunizations during the pandemic. We talked about reminder recall. There is a COVID-19 toolkit, which is something that you ought to take a peek at if you already haven't done so. And of course, shots for school, so you can get information about school-age kids and kids going into daycare. And of course, the American Academy of Pediatrics, hashtag call your pediatrician, excellent site. AAP vaccine communication aids, great resources. Next slide, please. Vaccine materials for parents. There's COVID-19 vaccines for children and teens. This is something that we just added because remember the recommendation has changed for the Pfizer vaccine, is now available or recommended for 12 years of age and above. So you might want to get some information on that. American Academy of Pediatrics has some specific information on the COVID-19 vaccine. Great resources, science behind the COVID-19 vaccines. These are all geared towards parent frequently asked questions. VSafe is a program for those of you who have already received your COVID vaccine. VSafe was a way to encourage parents to register their children for post-vaccination symptoms check. When I got my vaccine, I did it and came every couple of days and then once a week. And then I believe right now I'm like once a month. So great information. Next slide. And we'll wrap this up. Just some more information for you. I'll let you read those on your own when the slide set becomes available, or when the web becomes available, you can look up some of this information. And I believe that's my last slide. Joe? Yes, how about that? Just quick shout out to two of the public health medical officers that I work with, Dr. Liu and Dr. Hoover, and of course, the wonderful health education specialists that I work with, Rebecca Boych and Anya Gutman, for sharing their time and their contributions for this. And with that, I'll turn it back over to you, Joe.
Thank you, Steve. Thank you guys so much for all of your presentations today. We don't have any time for questions. Want to let everyone get back to their afternoons, but thank you guys for joining. As Steve mentioned, this will be available. And please reach out to either Veronica or myself if you are interested in getting lists of your members who may need to come in for immunizations. We have those available on our provider portal. And Veronica and I are happy to help you pull those so you can find a list of the kiddos or adults that need their immunizations, especially for back to school. So we'll wrap up for today, but please don't hesitate to email us with questions and we will of course get back to you. Thank you, Steve. Thank you for CARE and RIDE representative presentations. Thanks, Veronica, and thank you all for joining us. Have a great rest of your day. Bye-bye.